Yeah, okay. So good evening from India. I'm Dr. Gokhularam Gunasekaren. I'm a practicing general physician at the Govt Medical College with Nagar in India. It is a case of deep venous thrombosis, which I saw through my practice in my hospital a few days ago. Okay, so as we all know, deep venous thrombosis, it's a condition in which there is clots of blood getting accumulated in the lower limbs of the uh, patient usually. So as you see, so basically the etiology of these are venous stasis, hypercoagulability, and vascular injury. So also known as endothelial injury, which we also call it as virtuous triad. Okay. So in this particular patient, the patient was a pregnant female, also a postpartum mother on her day 28 of her pregnancy, of her post LSCS uh, uh, post LSCS, I mean, on the post-operative day of 28, okay. And the patient was referred from a nearby primary health center with complaints of pain and swelling in her left leg for the past 3 days. And on examination, we found that the lower limb, that is mainly on her left leg, it was especially swelling was present, tenderness and warmth with a positive Homan sign. So, and there's no any other history of chest pain, palpitations, or dizziness. And coming to the past history, and patient has no significant comorbidities. And also the patient, and as per a personal history, she was also having a mixed diet and normal bowel and bladder habits. And coming to the obstetric history, she was a para 2 live 2 female with the permanent sterilization done, and she had a regular menstrual cycles and with normal flow. And she attained menarche at the age of 14. Now, as you know, as we know, the risk factors, especially in postnatal women, are elderly multigravida, then recent section accompanied, I mean, plenty huge amount of blood loss at the postpartum hypercoagulable state, and mainly decreased ambulation, which I would like to emphasize because here in India, we usually tell mothers to ambulate within the day two, post-op day two of LSCS. But unfortunately, in this patient, I think maybe due to lack of information, I hope there was decreased ambulation, which led to her condition in as DVT. Now, as per our investigations, we found that the D-dimer levels were elevated, and also the Doppler USG, we found there was a thrombus which was present in the left popliteal and femoral veins. And coming to a full blood count, it was absolutely normal. Her coagulation profile was normal. Upon performing an echocardiogram, we found that there was no evidence of intracardiac clot, and there was normal biventricular function for the patient. And coming to the treatment part of this, we usually give a weight-based low molecular weight heparin therapy for about 6 months, after which we refer the patient to the hematology clinic for further follow-up. Now, this can also be prevented by providing the patient with compressive TED stockings and early ambulation, as I said before, and adequate hydration, which is also another essential factor to prevent deep venous thrombosis in a postnatal mother. Now coming to the discussion. So as far as the discussion, the postnatal mother are highly vulnerable to thromboembolic events. Because of increased clotting factors, reduced fibrinolysis, and venous congestion. And coming to C-section delivery increases further risk. So we advise the mothers for adequate hydration, as I mentioned before, and early ambulation as soon as possible to prevent any venous pulmonary thromboembolisms. Now, I would like to conclude the topic by saying that there's a high suspicion of DVT in mothers, especially the mothers who have undergone LSCS, that is a low segment cesarean section. And it is also important as physicians from our side to monitor these patients via Doppler imaging and initiate anticoagulation therapy as soon as possible in order to reduce maternal morbidity and mortality. So, coming to the prognosis, the patient remains at high risk of thromboembolism in the future, also as during any part of the post-operative period, and it can also increases in the subsequent pregnancies. So, in such cases, we advise patient to have a low molecular weight heparins throughout the pregnancies, and also extending up to the 6 weeks of postpartum period. And this is essential to prevent both venous thromboembolism and maternal death. So, I think. My poster presentation was helpful, and I would like to come up and I'd like to have any questions from the participants, if any.